Welcome, I'm Brian Hartog. I'm a orthopedic surgeon in the Minneapolis-St. Paul area here in the United States. I'm here as an invitation from the Carestream company to talk about my experience with the Onsight 3D imaging that we just put into our office about 8 months ago in Woodbury, Minnesota. I've been in clinical practice for about 27 years, doing mainly foot and ankle surgery, fellowship training in those areas of sports, trauma, and reconstruction of the foot and ankle. Not until recently have I had the opportunity to be partake in the Carestream technology. Our group, Twin Cities Orthopedics, purchased one unit, which is in our office in Woodbury, Minnesota, and we're going to be purchasing a second unit for our Eagan office that's opening up in about 1 month. So it's been a wonderful technology for me, and I'm going to share a little bit about why it has, to a certain degree, changed the way I treat my patients and evaluate my patients in office and also post-operatively. So why do I use an in-office cone beam CT scanner? As I said, I didn't really use this until just recently. It was a technology that I knew was out there, but to have a CT scanner in the office was actually quite expensive. It's really kind of changed what I do. It's changed the way I see patients. But I use it because we really have diagnostic challenges as foot and ankle surgeons. Dr. Canali here with me is one of my co-fellows way back in the early 90s. But the foot and ankle anatomy is very complex. There's a lot of joints in the hind foot, namely the subtalar joint, talonavicular joint, and also Lisfranc's joint, that are very difficult sometimes to read on X-ray. How much cartilage is left in those joints. For example, the subtalar joint is a saddle joint, so it is difficult just on a lateral view to see across that joint to see how much cartilage you have and how much is still remaining. Or if there's any kind of an osteochondral lesion or failed fusion, etc. So we also treat a lot of common deformities, pes planus, cavus deformities that are really dynamic deformities. So the weight-bearing part of the CT scanner is very important, and that we don't always know from just plain X-rays or MRI scans, which are not dynamic tests, whether we have ligament instability or we have a certain amount of cartilage loss. And the weight-bearing part of this, especially with foot deformity, allows us to evaluate joints with a weight-bearing view to see whether or not those ligaments, such as the deltoid ligament or the spring ligament, are actually stable. And if they aren't, then we'll see that on the 3D imaging or even the two-dimensional imaging on these CT scans that are weight-bearing. So we do a lot of redo surgery, and we've seen a lot of it helps us to know where the pain is coming from with people who've had surgery before. Again, with previous hardware that's been placed or previous attempted fusions, we don't know for sure whether the fusions have healed and if that's the source of pain the patients had persistent. So again, the CT scan is very important for this, especially the weight-bearing part, to see if there's any residual instability in some of those joints. Residual deformity, broken or loose hardware. Again, it gives us a lot of detail to work through all that.